guys, this is Dr. Hub. Today we'll look at the autoimmune. The autoimmune hemolytic anemia. So under this there is a comparison between the warm and the cold. Now we'll look at what is the warm agglutinin. Warm agglutinin, AIHA. AIHA is nothing but autoimmune hemolytic anemia, as we discussed above. So in under the warm, let's look at the etiology. So what is involved in the etiology? It includes drugs. So drugs such as the penicillin. Then comes the presence of the viral infections, and they can also be the autoimmune. The autoimmune, it can include the SLE, the immunodeficiency states. So this can include as well as the lymphoproliferates. Examples are CLM. Now let's look at how do the patient present to us. So the clinical features is or clinical presentation. It is the direct. There is a direct Coombs positive. So there is basically a direct Coombs positive, and this is with the anti-IgG. So it is a direct Coombs positive and it has an anti-IgG. Next comes the presence of the anti-C3. So there is anti-IgG, there is anti-C3, or it can be both. Next we move on to the complications. So what are present in the complications? So they can be the venous thromboembolism. There is venous thromboembolism. Then there is also presence of the lymphoproliferative disorders. They can be the lymphoproliferative disorders. Then how do you treat this warm agglutination? Agglutinin AIHA, that's autoimmune hemolytic anemia. So by the administration of steroids. Next there is also the splenectomy as well as a rituximab. Next we will look at the cold agglutinin AIHA. So what happens to the cold agglutinin AIHA? So the etiology is that it includes infections. So infections, that is, they can be mycoplasma. There is mycoplasma pneumonia as well as the EBV. Then we move on to the lymphoproliferative diseases. Then how does the patient present with? So they can be a livedo reticularis. This livedo reticularis and the acral cyanosis. They can be the acral cyanosis, and this is with a cold exposure. This is with a cold exposure, and also it disappears. It disappears with the cooling. It disappears with the not cooling. It disappears with the warming. So what about the test reactions? So here there is a direct Coombs positive. There is a direct Coombs positive. So direct Coombs positive means there is a anti-C3 with the anti-C3 or the anti-IgM. So there is anti-C3 or the anti-IgM, but usually not the IgG. So it is usually not the IgG. Next let's look at the complications. So complications of the cold agglutinin AIHA. This involves the ischemia. So they can involve the ischemia as well as a peripheral. They can be the peripheral gangrene. Then comes the lymphoproliferative disorders. There is lymphoproliferative disorders. Now let's look at what is the treatment. The treatment of the cold agglutinin AIHA, it includes the avoid cold exposure as well as the rituximab. Avoid cold exposure as well as the rituximab. Next is that there is no role for steroids. So there is no role for the steroids as well as splenectomy as well as the IVIG.